Good morning, ladies and gentlemen. The next panel is Investing in Healthcare Technology, Key Considerations and Lessons Learned. We have Mr. Goh Ming Jin as the moderator of this panel. Ming Jin is the Director of Corporate Finance at EVYD, with deep knowledge of the financial industry gained through 10 years of practical investing experience and a proven track record of achieving strong returns. He started his finance career in the investment banking division of HSBC, working on landmark M&A and capital markets transactions for leading large corporations across Southeast Asia. Ming Jin later joined Temasek, where he made both private and public market investments globally and contributed significantly to several landmark transactions in Singapore. Ming Jin later left Temasek to focus on early stage venture capital investments and helped set up with Singapore office for an overseas family office where he was responsible for investment strategy and operations of the Singapore office. He graduated with a Bachelor of Business Admin, Accountancy, first class honors from NUS. Ming Jin?
Thank you, Deanne. And first of all, a warm welcome to everyone here today. Thank you for joining this panel discussion on investing in healthcare technologies, key considerations and lessons learned. So I'm pleased to announce that we have actually invited 4 distinguished speakers coming from different types of organizations and geographies to share their respective experience in investing. So now let me take a couple of minutes to introduce our speakers for today. First off, we have Dr. David Walcott. He's a medical doctor by training and founder of Novamed, an investment firm focusing on healthcare investment in emerging markets such as the Caribbean and Latin America. Next, joining us online is Ms. Stephanie Mobley. She's a senior vice president at Highmark, one of America's leading health insurance organization. At Ayako, she has held various roles and is currently responsible for growth strategy and also business development activities. So moving from west to east, we have Ms. May Loh. She's currently an investment director at ABC Impact, a Singapore headquartered private equity firm dedicated to impact investing. She brings with her many years of experience investing across the different verticals of healthcare sector. Last but not least, we have Ms. Ayako Inagaki. She's the head of the Southeast Asia Department, Human and Social Development at the Asian Development Bank, where she leads lending and non-lending operations to the healthcare sector. Concurrently, she also chairs ADB's healthcare sector group. So as we all know, over the last few years, investments into the digital healthcare space have been increasing steadily. And this has been really largely driven by the need to provide new digital solutions and delivery models to patients in the face of the pandemic. While this has helped to actually accelerate the growth and adoption of digital solutions, now that the pandemic is coming to an end, I'm sure all of us is asking the question, which development has been most impactful in the different markets and will continue to see sustained interest from the investor community? Whereas which are the areas that will actually kind of unfortunately fade away with the pandemic? So maybe on this topic, can I first have David? David, could you share with us your experience in the emerging markets?
Thank you so much, Ming. Again, happy to be here. Happy to share my experience as an investor in emerging markets. You mentioned going from west to east. How I think about healthcare innovation is from north to south, right? And the sort of innovation we're seeing in the global north differs from what we're seeing in the global south. In the global north, many of these sort of fourth industrial revolution technologies, precision medicine, AI, big data, etc., have been infusing healthcare and have really transformed the landscape. However, in emerging markets, where Maslow's hierarchy of healthcare needs is significantly different, with high levels of access still being the most persistent challenge towards healthcare delivery. The most impactful healthcare development that I'm seeing is a greater level of adoption of technologies that allow for delivery of healthcare services, i.e. telemedicine. With the pandemic, which drove a sort of forced adoption of digital remote health, we're seeing where communities that previously were, a part of the last mile have been acculturated to what health technology looks like. And I think this really brings the greatest level of potential for healthcare moving forward. However, of course, leapfrog opportunities do exist. If these sort of trends of adoption are sustained, the potential to synergize things like artificial intelligence to drive greater levels of diagnostic capacity and the capacity to deliver care can really move the needle on healthcare in emerging markets.
Right, thank you, David. So maybe let's move to a slightly more advanced, or I would say the most advanced market, right? So Stephanie, we all know that US is a very advanced market for the healthcare sector. So can you share with us your experience in the US? Is it different from what David experienced in the emerging markets?
Yeah, so first of all, thank you for having me. It's a pleasure to be here. I think as I reflect, like all of us, coming out of a post-pandemic world, I think what's really happened is we've underscored the need for healthcare to continue to transform. And so for us in the US, as an insurer in the US, this is not new for us. The industry fundamentals have pointed to this for quite some time now. We've had a rising cost of healthcare with the worsening health of our population. We've had a series of fragmented providers looking to grow scale and figuring out their economics, along with now, after the pandemic, facing significant fatigue and facing burnout. And so simultaneously with these two factors, we're also seeing heightened consumer demand for things that are easy to use, with large technology disruptors and small technology disruptors entering into our marketplace. And customers are demanding that of their healthcare experience in the United States today. They're demanding that things be simple. They're accustomed to using their iPhones for as many things as possible, and so they're welcoming these technology disruptors into our industry. I think in terms of digital innovation, what you're seeing from insurers kind of spans a couple of categories. The first is just ways to reduce the administrative cost burden of using the healthcare system in terms of self-service tools for members. So easier ways to schedule appointments, easier ways to pay bills, really just looking at members and providers to improve an omni-channel way to kind of have access. You're also seeing payers invest in sales support and automation. So in some cases, as you know, we have federally funded or state funded programs, and then we also have employer-based programs. The more from an insurer perspective, we can ease the administrative burden and take away some of the things that are costly manual labor for us and automate those activities, we're seeing that can reduce our administrative costs. From a medical cost perspective, from a digital perspective, lots of startup companies are emerging with point solutions that start with the analytics in mind and help us walk through a guided care model to solve for many different disease states or different wellness programs. We're in an era in the United States of real-time experiments. People are investing in many different facets and trying to figure out what works. Across all payers, I think the common theme is, as an insurer, we believe that we can be part of the journey from wellness to sick to, end of life. And so while tech disruptors are coming in at various points along that continuum, I think it's going to be a while until someone can connect everything across. So those point solutions and some of those sort of digital solutions, automated intelligence, analytics to support them is a really big focus area in the US right now.
Right. Thank you, Stephanie. Thanks for the insightful and comprehensive overview of the US market. So maybe moving closer to home, May, coming from an investor in Southeast Asia region, what are your views and thoughts on this?
Right. First of all, thanks for having me here. I also want to, give you some context on how we look at things at ABC. So we're an impact PE fund, and so when we look at investment, invariably we look at businesses that have the potential to create positive impact through its services or products. And in, I think, digital health, we've seen a lot more activity levels recently in Southeast Asia as well. And how we look at this is really in terms of like two types of impact, right? If you think about healthcare services or products, broadly, we see two types of benefits. First is really the direct impact on the user, and this can be any of the stakeholders in the ecosystems, be it patients and their families, doctors, nurses, other healthcare workers, hospital operators, payers, governments, insurers, etc. But then also on a less direct level, there's a population or systemic layer of benefit through enhancing efficiency to the system and hence saving cost, as well as like improved health outcomes on a population level. And what we see here is really that a few years ago, during the initial stages, we see a lot of the focus is around more direct impact. And so you see a lot of these like teleconsult, telemedicine, or like pharma delivery platforms that come up. And it's really about very focused on the patient or the user themselves, enhancing access, etc., convenience. But increasingly, we see more thinking going into the population or systemic impact. And that's also something that we would like to back and support as well. But for that to be realized, the business model actually needs to be carefully thought through with value proposition, very concrete adoption strategy, as well as a very sustainable commercial model. And definitely we see that maturing over time, especially with more adoption during COVID. So that's a very positive development that we are seeing. And to summarize that, we see specialization. So specialization can be in the form of the types of conditions. So it can be a special area of healthcare, for instance, mental health. It can be chronic disease management. Rather than when we first see teleconsults spring up in the region, it's really more about GP consult, or like sometimes it's screening, right? But now you see a lot more depth in the specialization. Specialization can also be in terms of the types of beneficiaries. And what we see quite interesting is in the areas of, say employee health or workers' health. Because I think Southeast Asia is also, especially I'm talking about the more developing parts, there is a problem with access and the uneven distribution of access to care. And in a lot of these countries, such as Vietnam, Indonesia, you do see huge population of workers who are present in areas that are outside of urban centers, and that's where care may not be delivered evenly. And so with the use of digital health, we do see opportunities there, and I'm happy to see businesses that are now catering to those specific groups. So like employees' health, people working in factories, etc. Or other types of examples would be elderly population or like children. And then because of that thinking, I'm also seeing more like B2B kind of model in addition to B2C, or like even B2G when we're talking about data analytics and managing population health on that broader level. So I do think those are the positive developments, and I see sophistication and maturity in the sector.
Right, thank you, Ming. So maybe I could get Ms. Ayako to add on. I know you have extensive experience in the Southeast Asia region too. So coming from a development bank, what are some of the developments that be most impactful for yourself?
Yes, thank you very much. Good morning, Min. I'm really happy to be here. From the development bank perspective, since we have been doing a lot of, lending investment to our developing member countries in Asia and the Pacific, and particularly I'm going to talk about the ASEAN region. There are three aspects of digital health developments which we feel that have been most impactful, and we hope that is going to be likely to sustain. The first is as two of my colleagues, previous speakers have mentioned, is really about the telemedicine and related to remote online provision of health services, particularly as you see the huge pressure obviously on the health workforce and the kind of demand for health services which obviously in a normal circumstances people cannot really have access to. So the pandemic resulted to rapid scale up and roll out of this telemedicine and other online health service delivery, and we are seeing this disruption being sustained and even enhanced in many aspects. And we do hope that is going to be sustained. Second, similarly, we have seen a timely capture of individual data in COVID-19 testing and vaccination, the use of big data tools to analyze the resulting database, and the data and analysis informing the key decisions by the policymakers. And this has enabled, for instance, this contract tracing and the use of vaccine certificate, which were key for countries. Countries need to build on these gains and explore an effective use of big data in various aspects in healthcare development in the future. Finally, we saw a lot of this government and private sector working closely to develop and implement this digital health tool. Some good example, of course, is this, for instance, a vaccine information management system, for instance. Different countries have a different sort of um, enabling environments for collaboration between government and private sector. But we felt that the lessons learned for the pandemic is that it has really boosted this collaboration because it was, urgent needs to do so. So it's how to build on this gain, excuse me, and to strengthen this collaboration. So those are the 3 points from my side. Thank you.
Right. Thank you, Mr. Ayako. So I think the next question that is like on all of our minds is really from an investor point of view, what are some of the key considerations when investing in the healthcare industry? We all know that returns are important for investors, but is it just purely financial matrix that we should be looking at, or are there other indicators or matrix that we should be aware of? So, May, I understand you kind of touched on that a little, but maybe from a as an impact investor, would you care to like elaborate more? Like, what are the other key metrics that you will look at, and actually how do you measure some of these non-financial indicators?
Sure. I think that's a question that we always get because impact investing is quite a new area as well. So actually, a very clear part of our mandate is that impact and financial underwriting are equally important in our investment process. And we need to make sure that every investment meets the hurdle for both. I think the financial part is no different from any other PE investors looking at the sector. So I will focus more on talking about the impact part. For impact, we actually formulate the impact thesis for each investment on a case-by-case basis. And it's precisely because I think some of the speakers mentioned that the enabling environment for, even for digital health is very different from country to country, and the baseline is very different. And so that would affect the impact pathway as well. And by impact pathway, we really means what we really mean is, identifying the pathway through which services or products of a target business can contribute to the outcome. And for us, the outcome is we are anchored to the UN SDGs, and you probably all know that for healthcare is SDG 3, and it's a very broad objective and goal. It's actually universal healthcare coverage. And so what we look at is really how a particular offering or like services is contributing to that. It can be in terms of the number of people who are gaining access to care, So we have to, in that case, compare what's the base case, i.e. the situation without that service versus with that service. Now, it is quite challenging, I have to admit, and especially in Southeast Asia where healthcare data is very lacking. So I do think that, with advancement in digital analytics, capturing of data, that will help also in our area of work as well. Because right now, the primary and secondary research in terms of health data is quite lacking in a lot of the Southeast Asian countries. And I'll give you an example. I think earlier we invested in a dental provider in Vietnam. And I think the base case is really to look at how many people have access to dental care. Also, what are the exact healthcare outcomes that having access to dental care can bring. So I think most immediate impact that people would think of is just maintaining your oral care. But actually, through our research, we also find that having good dental hygiene and also regular checkups help prevent other types of non-communicable diseases. So that's how we kind of formulate the thesis, really to map out all the outcomes that the services is actually bringing to the table. And for us, the underwriting process is really two. One is looking at past data and validating that thesis, and the other part is really underwriting for projected outcomes. So projected number of patients, sometimes it can be cost savings. It can also be, other indirect beneficiaries, such as training of employees, clinical talents in that particular jurisdiction. So, and that's why it has to be case by case, because one, it's affected by country dynamics, is affected by that particular subsegment in healthcare. And for us, what we are trying to achieve is evidence-based underwriting for impact. And that also informs how we monitor and track the data post-investment to make sure that that particular target is adhering to the impact that we are underwriting. Yeah, I hope that kind of explains in a nutshell what we do. There are a lot more subtleties varying from case to case, but overall, that's what we try to do. Yeah.
Right, thank you, May. I think that has been very insightful and helpful for us to know about this new area of impact investing. So I think maybe moving on, right? I think all of us have always talked about emerging markets, and in my mind, is maybe a very risky endeavor, right? And it's very mysterious because we are not sure, the rules might not be so developed and all that. So maybe David, could you share with us what are some of the key considerations when investors are looking to invest in emerging markets?
Sure. Well, first of all, I think any investor who is investing, one, in healthcare and two, in emerging markets is in fact an impact investor, even if not so titled. Sort of by definition, I mean, it can be a challenging landscape to navigate from a general business perspective. And when you superimpose funding a solution in which you're competing with the government and you're offering to serve a broad population that has low purchasing power, by definition, it's an uphill battle. So what, broadly speaking, any investor would be looking for is, I would say lagging and leading indicators of value creation. Is the company making money? What is the level of engagement? KPIs around operations, cost, quality metrics, etc. Those are the sort of hard things investors are looking for. But I think there are a few softer things that will emerge looking at healthcare in emerging markets. One, by definition, investments have to have some balance of profit and purpose. Profit is easier to fund, purpose is more difficult, which is why I think investors like to see blended finance models that reduce risk. For example, this Ayako here from the ADB, development banks are key towards supplementing private sector level trust in investing in healthcare in emerging markets. And so for example, for us, Novamed, we invest on a risk, obviously, as everyone does, on a risk-adjusted basis, but we have invested in one of the most risky ecosystems, business ecosystems, Haiti, only because we have partnered with the Inter-American Development Bank to co-invest, right? So that's one. Two, investors like to see, creative business models and some level of effective risk management. And we can go into all these sort of fancy models of risk management, but ultimately investors are looking for character. One, the character of the founders, their capacity to deliver, capital, how much capital they need, and is that capital appropriately and judiciously allocated, for what are the conditions of their investment, and five, what are the sort of creative outcomes they're seeking to drive. And thirdly, I'd say investors, at least certainly from my perspective, looking at emerging markets, are looking at opportunities that are client-oriented. Emerging markets tend to rely to a greater extent on human touch. And so we believe that businesses with a human component will outcompete those without in emerging markets. And so those are the sort of things that healthcare investors in emerging markets should be thinking through and evaluating opportunities.
Right. Thank you, David. So maybe, Ms. Ayako, now since we are on the topic of emerging markets, maybe let's hear from a different perspective. So from a development bank perspective, what are the key considerations when investing into healthcare for yourself? What are the primary goals and considerations? Would that still be financial considerations, or are there other metrics that are more important and that are of first priority?
Yeah, no, thank you very much for these very important questions. To me, obviously, the development impact, the development outcome is really a key. So among the various tools, obviously, to consider what could be the rate of return, or what could be really the benefits of the investments that will be recommending, our developing member countries to consider. It's really important to, once technology that are being determined appropriate, it's important to evaluate the economic benefit of such investment or adoption. So an example is investing in big data in the health sector, which obviously we talked also a lot about that. So we had several studies, and those suggest that, for instance, by using big data in the healthcare sector, about 25 billion US dollars in estimated benefit could be derived, and with about 15.5 billion US dollars benefit generated from the use of data analytic tools to guide public health interventions for the at-risk population. And another $9.4 billion benefit from remote patients monitoring. So how do we do that? So benefit from the use of data analytic for public health interventions was estimated using the observed reduction in the disability adjusted life years, the DALY. The economic value is then calculated by multiplying this with the GDP per capita, and also based on the proportion of the population suffering from chronic diseases. So on average, it's on the economic value of the reduced DALY due to the timely public health intervention. For the application of remote patient monitoring system to improve patient care, so the potential dividend was estimated based on the cost saving to the healthcare system through the reduced hospital visit, the length of patient stay, and the medical procedures. Maybe two more points for consider when we're making the investment. Two, for me, quite important matters is that investing in building government readiness, a capacity to implement, utilize, and regulate this healthcare technology is important. So investment should not be limited to the hard healthcare technology. There's a tendency, obviously, because it's more visible, to focus more investment on the hard healthcare technology, but equally important is really what we may call the soft part, which is the capacity building. And finally, investment decisions obviously should be clearly aligned with the government's overall policy on healthcare, or let's say much more broadly speaking, it's really the universal health coverage strategy. I stop here. Thank you.
Right, thank you, Ayako. And Miss Stephanie, coming from a corporate background, what are some of the considerations for yourself when investing? I always hear the talk about this is strategic, so we got to invest from a corporate perspective. But from your perspective, is strategy the only consideration, or do we still talk about financial returns at the end of the day, and how do we measure some of those, right?
Yeah, it's an excellent question. So I'll start with sort of the landscape that insurers are wrestling with today, which is, a need to continue to cut costs for our members, medical costs and administrative costs, because the cost increases are unsustainable. So we have to simultaneously cut costs, but also invest in the future. Federal funded and state funded programs are putting an emphasis on insurance companies to make sure that they not only lower costs, but they also improve quality for the members that they serve. And so, being honest, I think insurers across the United States tackle this problem quite differently depending on their mission. We do have for-profit insurers in the United States as well as not-for-profit insurers. And I think, unfortunately, in some cases, some people just put very stringent rules on utilization. And in my experience, this can result in strain on the provider community, frustration for patients, and a deterioration of the quality outcomes that can be put in place. Too much focus on just a near-term ROI of taking costs out of the system is not a sustainable long-term business model. What I'm seeing is the payers who can find a balance between an ROI on their investment, but also focus on investments that improve access to care, quality of care, and wellness in the community, right? Making sure that we're propping up the communities as well as, the members and the providers. This means a series of solutions that work across an entire continuum of care. And it also has to think about the investments that we make from an urban to a rural standpoint, from folks that come from different economic backgrounds. And so I actually do not think that it's a financial ROI-driven decision only. I think the successful payers are emerging when they are able to think about the span and scope of reach, think about how we can provide solutions that have a health equity and a social determinants of health mindset to them. And I think some will say it's just ROI, but I think that the leaders will emerge if they can consider sort of the full gamut of activities.
Right, thank you, Stephanie. So we all know that investing actually entails a lot of risk, and there are many reasons that investment can fail, especially in an industry as complex as healthcare. So maybe Stephanie, could you let us know, right, from your experience, what are some of the common pitfalls and what are some of the lessons that you have learned throughout your investing journey?
Yeah, so I actually think, building off of my last response, I actually think that assuming there is a one-size-fits-all model or one digital solution that will apply to all different patient populations is probably the biggest pitfall that people fall into, right? I think for us, and for all of us, no matter where we sit on the globe, right, healthcare is an extremely personal, often life and death decision that family members and folks closest to you have to make. And so because it is heavily dependent on personal circumstantials, cultural background, access to dollars to fund it, I think that we have to be really thoughtful in the types of interventions that we're targeting. Specifically in the digital space, I think that there is still a ton of opportunity and a ton of investment dollars that need to be made to make experiences better. But I think we have to be clear on what subset of the population we're trying to solve for. I've seen in the US where we're using artificial intelligence to analyze past data, so that we can better inform clinicians about care paths. That is something that, regardless of where you sit in the world, that could help us, right? And so I think those things are really important. Giving tools to members and patients to stay in the community, to stay where they live and can find the most comfort and be the most supported. Those are the types of digital investments that I think we need to be focused on. And I think we have to clarify how certain solutions apply to different patient populations, and not assume that one size will fit all, depending on personal background.
Right, thank you, Stephanie. And maybe moving on to Ms. Ayako, from a development bank perspective, what are some of the common pitfalls that you see, and what are some of the lessons that you have learned?
Yeah, thank you again for the very important question. On the last point that Stephanie made on that, one size doesn't fit all. And I fully agree with you in a sense that I think for me, what's the most important lessons learned is how to determine the most, appropriate technologies that the countries, as well as, maybe local governments or even communities want to invest in. So it's really the importance of proper due diligence. So it's a due diligence to determine the safety, effectiveness, quality, and here I would say the relevance of the health technologies that each of the country or local government or community plan to invest on. So as I think as a whole community of people caring about healthcare, it's really to help these stakeholders to make informed decisions on what healthcare technology to invest in and to help them conduct this proper assessment. Uh, Many countries, many companies are offering, obviously, the respective health devices, equipment, and technology. And I believe that, they are perhaps targeting specific context, specific populations, and those are very good quality services. But it's really how to determine which is the most appropriate technology. Because then really the lessons learned, the bitter lessons learned is that we need to acknowledge that in case when investing in a not so appropriate healthcare technology and the resulting adverse impact of such investment, obviously on the health of the population, or it's a sort of failed investment, will also result in a future risk adverse behaviors of that countries on procuring future technology of the same nature. And obviously then it's an unfortunate adverse impact. So that's really, I think, what we need to avoid. Yeah. Thank you.
Right, thank you, Ms. Ayako. And David, what about yourself? From your experience in the emerging markets, what are some of the common pitfalls that we should look out for?
Yeah, well, just to share, I know we're running short on time, so I'll just sort of synthesize quickly. I think one of the big pitfalls I see is that founders and capital allocators don't necessarily meet each other where they are. In many cases, founders who have excellent ideas don't understand how to communicate and speak the language of funders, and so opportunities end up being passed over and not funded because they're unable to be articulated in frameworks that work for funding bodies. For example, a founder has to understand how to articulate a concept to an impact investing firm versus a non-impact investing firm versus a development bank. And this is a level of I would say, insider knowledge that often only comes with experience, but unfortunately, many founders who have excellent ideas and have the capacity to execute don't understand how to navigate this translation gap, right? That is one. And two, I think funders need to develop new means of assessing risk. In many emerging markets, funders are obviously not specialists in healthcare, and so they end up allocating excessive levels of risk due to unfamiliarity with the industry dynamics, and of course end up not funding opportunities. The example I always give is it's very easy to get real estate funded because everyone understands real estate, and so in some cases I've had funders who have packaged hospital deals as real estate deals, right? It's the same deal, but just wearing a different suit. And so I think that there is a greater level of, I would say, there's an evolution that needs to happen on the side of the founders in being able to speak the language, and on the side of the funders in being able to appraise healthcare opportunities with a greater level of sophistication.
Right, thank you, David. And lastly, May, what about yourself? Are there any lessons that you think will be relevant for all of us here today?
Sure. So I just like to bring it home to Southeast Asia, and I think it actually echoes what Stephanie mentioned earlier about really paying attention to local dynamics and preconditions that exist in different countries. What I see is in Southeast Asia, people are tempted to build a regional expansion plan across Southeast Asia without actually realizing that Southeast Asia is not one country, right? It's immensely challenging and complicated to build an expansion plan across Southeast Asia. There are actually commonalities, but I think you actually just have to spend the time and be very thoughtful about what's applicable and transferable across countries and what's not, right? Because the healthcare system in Brunei or in Singapore is very different from in Vietnam or in Indonesia. And to think that you can just simply transfer that whole model to another country very quickly is just a little bit naive. And also, I think it actually happens to quite a number of companies. Maybe they're under the pressure to show that there's actually a very large market, because we know that for Southeast Asia, individual countries sometimes is a pretty small market. And but we also have to realize that, the complexity of that plan. Yeah.
Right, thank you, May. And given the time is running short, maybe I would just like to wrap up by saying that I hope everyone here today has gained a better understanding of the different investor mindset from different types of organizations and also across different geographies. And I hope that this will actually lay the foundation for continued and increased investment interest in the digital healthcare space. So with that, we'd like to thank all of you for taking the time off your busy schedule to join us today for this panel discussion. Thank you.
Thank you.